This is James Murray with Net News Ledger, part of our continuing COVID-19 coverage for the city and the region here in northwestern Ontario. Today we've got Chief Peter Collins and Charla Robinson from the Chamber of Commerce with updates for the community.
Hi, it's Charla from the Thunder Bay Chamber of Commerce. We know that this is a very uncertain time for businesses, and so we're going to do our best to get the information out to you about all of the changes that are being supported by government through a video, and hopefully that'll be helpful to you. So this conversation today will be about two programs that were recently announced, the wage subsidy program and the EI work sharing program. So yesterday, the Government of Canada announced a temporary wage subsidy for small businesses for 3 months. The subsidy will be equal to 10% of remuneration paid during that period, up to a maximum subsidy of $1,375 per employee and $25,000 per employer. Eligibility for the subsidy includes corporations that are eligible for the small business deduction, but check last year's tax return to find out if you were eligible for that deduction, as well as not-for-profit organizations and charities. And we have been advised that the subsidy will be applied immediately to eligible payroll remittances. So expect to see that in your remittances this month. The second program is the EI work sharing program. So the government is implementing a work sharing program which provides EI benefits to workers who agree to reduce their normal working hours. They're changing the program to include some changes to eligibility requirements, trying to make it easier to access, and are streamlining the application process. So if you or your business are interested in exploring the work sharing program for your business, and for details about other EI programs, you can access a link to the Employment and Social Development Canada website on our resource page at tvchamber.ca. Hope this is helpful. Feel free to give our office a call at any time, 624-2626, with any questions, and we're here to help you through this time. Thanks and have a great day.
First of all, my name is Peter Collins. I'm the chief here at Fort William First Nation. We are in a situation now where we're dealing with trying times in our community, and it's a new way of life in our community that we must deal with. We must protect our members at all costs. Rest assured that our council, along with myself, will continue to work to protect the environment of our community, to protect our people, to protect the health of our folks in our community. Our staff and our frontline people will continue to work to put plans in place to ensure the health and well-being of our members. We will continue to strive to create a sound, healthy environment for our members. First of all, let me give you a little update on the statement that came out a while back. And I know the folks in the community are waiting for my comments and my position on this whole pandemic that we're faced with. Our CEO sent out a message a week back, and I was part of the comments and part of the process of creating that position. And so I didn't want to give two messages at the same time. So our CEO, I allowed him to send out his message, which he did, and it's a great message. And there's still work to be done, and we'll continue to get those messages out. I want to give you a quick update on the PDAC conference, which put a scare in a lot of folks, not only members in our community, but myself and some of our staff that were attending that process. A few days or 3 or 4 days after we got back, there was a media advisory sent out advising that there was a person infected at PDAC. So everybody went on the alert, and we all did, and no doubt about it, I continued to work here and I continued to do my job. But in saying that, after that media release went out, we were then advised by email to each and every one of us that attended that function that the folk or the member or the fellow that was identified with the virus of corona did not pick up that virus at PDAC and was not infected at the PDAC conference. So that was that email followed a couple of days after the fact. So, into the folks in our community, I've been constantly on conference call after conference call after conference call. I just got finished another conference call just before lunch with Minister Miller and Scott, the regional director for Ontario, laying out the foundation for our communities and what are the resources and the stuff that we need to do, and we have to protect our communities. One of the things that we talked about is the funds that are coming from Ontario and Canada and how they're going to help our communities in the coming days and the coming months. The consideration for us right now is there's $100 million for First Nations across Canada to access. We're trying to figure out the breakdown and the access to that and what is the access route for that money. The other thing is there's $305 million that is very flexible for our communities to deal with our pandemic plans and making sure that our plans are well enacted in our community. So those are things that are continue on, and we will continue to work with all levels of government. The other thing that we worked with FNIB over the last couple of days, and the resources that we're looking for in our community is the PPE. The priority of mask and hand sanitizers and similar stuff like that. One of the big questions that we did have with FNIB is that talking about actual doctors and nurses in our community, along with respirators. One of the things we relayed on to FNIB is that a lot of our folks suffer with chronic lung diseases such as COPD, asthma, bronchial asthma, and different things like that. So, if they pick up the virus, it's going to be hard on our lungs and we're going to struggle with breathing. The other things that our council has discussed is the possibility of an emergency site, which would be our community center. Now, so there's so many different moving parts that we have to continue to work on. And I'll get into some of the stuff that the management has done to date. Management started a communication with the community about the coronavirus and the safety and precaution of the health and the health center team. Next came the decision to shut down the arenas, the bingo halls, and all different operations. At the same time, the social and health properties, the department started extra purchasing of supplies that can be accessed for our community members. And those supplies will be on hand in the coming days, in the coming months. We will also work, we're always also working with our people in the lands and hopefully extracting some of our land-based stuff, such as fish and in the wild meats that, protein is essential to our health and the health well-being of our communities. As such, our office has recently been closed to the community to protect not only the public, but our staff here that continue, as our staff have to continue to fulfill the needs of our community, to fulfill the obligation that we all have as community members and as your team. Following the pandemic plan, the stage we are currently at is still continues today. I mean, we will continue to plan. We will continue to plan day in and day out. Your management team meets on a regular basis, day in and day out, laying down a foundation for the health and well-being of our community members. We are following our pandemic plan, which our health department has been leading. The plan is very complex, intending on being able to cover every areas possible to ensure the community's safety. The pandemic plan involves the pandemic plan group. Each member of that pandemic plan group has a specific role and a specific responsibility to you as members of this community. The pandemic follows the stages in which tracks on how much a disease has spread. In the current situation, and this is the corona. At each stage, the pandemic plan group focuses on 5 areas, each with varying degrees of tasks appropriated to how much the virus has spread. These areas that we are currently are: number 1, the surveillance. The surveillance means that we are collecting information, interpreting it, then communicating the information to everybody. This ensures we are monitoring communities' health, ensure timely intervention, and reduce the spread of coronavirus. The emergency response and the public health measures, the emergency response areas has a goal to ensure the pandemic plan group along with the health officials ready for the pandemic. Also, the emergency response is aimed at establishing continuous states of readiness, which our staff will continue to do day in and day out. Public health measures goals is to stop the spread of pandemic viruses and gain time for implementation of medical measures. Also, it helps reduce the impact of the pandemic on our community. Keep with the recommended safety precautions as such. Wash your hands, avoid touching your eyes, mouth, nose, avoid close contact with people who are sick, coughing, sneezing into your sleeve, hands. Staying home if you're sick to avoid. We continue to look at budget. We continue to look at the financial, the extra funding. We continue to work with our elders to make sure that they're provided adequate resources that they need to stay healthy and stay well in their homes. We will continue to work with every level of government day in and day out. We will not let this get to our community. We will continue to protect our community at every cost. One of the things I want to say to the members of our community, I will do everything in my power to make sure we have the adequate resources and all the safety measures that we need to protect our community. I want to stay committed to the job that I have. I will not step down for any reason or any ask. I will continue to work with all levels of government to protect our community. There is so many different moving parts in this issue that we are dealing with as community members, as First Nation leaders all across the country. The main event that we talk about is the adequate resources for our members, so if they have lost their job, or if they've been laid off from their job, or if they're deemed that their place of work has been shut down, we will work with the Government of Canada to continue to get adequate resources to make sure they can still feed their families at the end of the day. I will work tirelessly over the next coming days, the next coming months to protect our community. I will work tirelessly with our group in our office to make sure we are doing everything to provide adequate resources to our members. I am also working with our health department or our health team at Delico, trying to put things in place that we have adequate resources. So if there is a pandemic in our community and we need those ventilators, we need manpower, we need nurses, doctors. I'm also working with the MPPs and the MPs and all different levels of government to continue our journey in the health and safety and the well-being of our communities. I assure you that your council, your management, and your staff in this organization are doing everything to keep you healthy and well. We will do all at all costs to protect this community. One of the things we talk about in our community is a state of emergency. Well, I just got off the phone with Minister Miller. He says, your communities do not have to call a state of emergency. The state of emergency has been called, and that state of emergency will protect all of our communities. We will get the adequate funds that we will need to continue on operating this organization on a day in and day out basis. Again, to the members of this community, I will work with our staff, I will work with our council to protect our community. I look forward to questions or comments in the coming days. My email is pcollins@fwfn.com. My cell number is 807-252-8642. If you have any questions or concerns, please give me a call or send me an email. I look forward to that further dialogue with our members in our community. As I said at the beginning, we will do everything to protect the health and well-being of this community. On behalf of my council, your council, on behalf of our staff here at Fort William First Nation, have a great day. Stay healthy. Protect your families. Miigwech.
If you found this video helpful, hit that subscribe button, hit that like button, share this video, and keep up to date on what's going on.